Okay, so I just got called to a patient's room, asked me if I could come check out the ventilator. So I could hear the urgency in their voice, so I got up and I went over to the room. Took me maybe 30 seconds to get over there, but still a good amount of time. When I got to the room and I was putting the gown on to go in, I noticed that the patient was being ventilated by a bag valve mask. So he's intubated, and they were having problems with the ventilator. And first I want to talk about this scenario. So this nurse did the exact right thing. They had a problem with the ventilator. They could tell that the patient wasn't getting the proper ventilation, that something was going wrong with the ventilator. And so first thing they do is they took the patient off the ventilator, they grabbed the BVM and they started ventilating the patient and took care of the patient first, and then they called me. So I get over there to the room and I see that the patient is comfortable, that the patient, his stats are good, his numbers look good. So then I turn my attention to figuring out the ventilator. And at first it was giving an alarm, so I cleared the alarm, I got the ventilator situated right again, and it seemed to be working properly. I put the patient back on the ventilator, and I saw what they were talking about. It bottomed out, it wasn't giving the air anymore, so we popped him back off, ventilated him with the bag. And so this is a pneumatic ventilator, and so I checked all my connections, I made sure everything was lined up, made sure nothing was disconnected on the circuit, and just checking over and over again. And what it turned out to be, because it did it again after a few minutes, it got back to normal ventilation, and then it did it again while I was sitting there holding the circuit, assessing it. So what it turned out to be was the air intake, the inline, was pinched off by a piece of equipment in the room. And what this was causing is a decreased pressure inside the ventilator, and it wasn't able to percuss like it should. And so it was bottoming out, it wasn't giving the breath until that pressure built back up. And so once we removed the obstruction from the tubing, the oxygen tubing going to the ventilator, normal operation proceeded. And so first and foremost, you want to take care of your patient. You want to look at your patient and make sure that they are comfortable and that they are sustained by whatever means is required. In this sense, it was a BVM to keep them going. Never look at your equipment first and sit there minutes on end figuring out your equipment while your patient suffers. So patient is always first. And then after that your patient is sustained, you either call someone else to look at the equipment, or if you can look at the equipment and get the patient back to a normal operating stance. So this is my video. I hope this helps you in your clinical experiences, and hopefully we can give the best care possible to these patients. Thanks. Thanks for watching this video as part of our Clinical Matters lineup. Don't forget to subscribe so you don't miss any future content, and I hope to see you soon.